15 puffs of a regular vape is about equivalent to 1 cigarette. So that 600 puff vape is the equivalent of 40 cigarettes.
Welcome to HSE Talking Health and Wellbeing. My name is Noreen Turley, and today's episode dives into the reality of vaping and nicotine products. We're really looking at the impact that this has on Ireland's young people and what parents and teachers and communities need to know. We will find out how the HSE are responding to keep our children safe. I'm joined today by Martina Blake, National Lead for HSE Tobacco Free Ireland, and Kirstie White from the HSE Quit helpline. And Kirstie is a Stop Smoking advisor. So we know that we have just launched a new vaping campaign called Take a Deep Breath. And this is a public health information initiative, which has just been launched, aimed to highlight the health risks of vaping products and nicotine pouches for young people. Martina, thank you so much. And Kirstie, thank you so much for joining us.
Thank you.
Yeah, thank you for having us.
And Martina, we'll start with you about this Take a Deep Breath vaping campaign. What is that all about, and why did we see a need for that?
Thanks very much, Noreen. Yeah, so, anecdotally, we can see, and we were hearing, I suppose, from schools, parents, teachers, principals, youth workers, that they can see a rise in vaping, and the evidence, unfortunately, is telling us as well that more young people are experimenting and regularly vaping and using nicotine pouches. In fact, we have 1 in 5 children now between the ages of 15 and 18 vaping regularly, which is kind of 20%, which is, really phenomenal and has grown over the last number of years. And in terms of nicotine pouch use, we have 5% currently using pouches and 10% have tried them. And that was seen in a study that the Tobacco Free Research Institute did last year and published last year. So, we're concerned that vaping has become very popular among young people, and the concern is around nicotine addiction and all of the risks associated with that. And we were given funding by the Department of Health to address this through a number of ways, but one of them is through a vaping prevention campaign. And so we will have 2 audiences as part of that campaign, and it will be run over a 12-month period. So the first part of the campaign was launched in October of this year, 2025. And our first audience, I suppose, is talking to parents. So we wrote out to all parents through schools, and we have done a number of other things. We've developed a radio ad called Take a Breath, encouraging parents to talk to their young person about vaping and about nicotine pouches, and keep those lines of communication open and encourage them not to engage. And then we will be launching the second part of the campaign, where we will have young people talking to young people themselves about vaping.
And Martina, it's very difficult these days. There's so many things to talk about. What kind of advice would you be given to parents?
We advised parents, I suppose, the prevalence and the increase in vaping, and we advised them to go onto our website, get informed themselves, understand this area themselves. So we have a lot of new information on our website as part of the campaign. So if you Google nicotine pouches, vaping cessation on Google, or go into the HSE website itself and search for those terms, you will come to those pages, and information about that will be available. So I suppose for parents, the guide is that this is the same as any other substance that they might present with. And experimentation and substance, trialing different things is a normal part of teenage growing up. But there are risks associated with that, and they need to kind of keep the lines of communication open with young people, and, set boundaries as well for their families as well, and in terms of what's acceptable in their own home.
Yeah. And, the thing is, when we say about vaping, and we've seen the prevalence of vaping, and we can see vaping on the streets, and we see a lot of young people vaping, the whole pouch thing and all these different new vaping products that are available, it's a minefield, really. So tell me a little bit about the vape, first of all. Then we've got pouches. Then we've got toothpicks. There's all these different nicotine products that I never even realised were out there. So it's an absolute minefield for parents to even know. I mean, I've never heard of some of them before.
Yeah, it is. And that's the industry behind tobacco and nicotine products. Their interest is in making money, obviously, and, targeting a new generation of children that will become, the purchasers of tomorrow and will continue to engage in buying a product that, they will make profit from.
Because our smoking rates have dropped to 17%, is that right?
Yeah, well, the smoking rates, I suppose, we would not call it dropped, but we would call it stalled. So in the last 5 years, we have, not reduced smoking, and we have a goal of reducing smoking to less than 5% by this year, actually 2025, and we haven't managed to achieve that as a country. So, since prior to COVID, the smoking rate has stayed at 17 or hovered around 17, 18%. So the introduction of e-cigarettes in the marketplace, I suppose, have actually hampered and, stalled smoking prevalence, because what we're seeing is actual dual use.
Yeah.
So more people are actually using e-cigarettes and tobacco products and becoming more addicted, actually.
Yeah.
And we did a survey to look at that, and quitting intentionality hasn't reduced. So that's a problem. But back to the products and what they are. So, there's lots of different types of vapes. So there's disposable vapes that are coming cherry cola flavour and strawberry lime and, lots of different types of flavours that are disposable that you'll see in your corner shop. Then there's these kind of vape pens, tank type vapes that you can click in different types of e-liquid and mix the different
they're all
strengths.
different flavours and
Different flavours, different strength. There's literally thousands and thousands of products.
Can I just ask you about snus and pouches?
Yes.
What do they look like even?
The snus that we see available here in Ireland comes in a tiny little circular box usually, and there's usually 20 pouches in the box. It looks like a tiny bit of chewing gum.
Right.
Actually, for all the, and it's like white, and it has inside in the little pouch synthetic nicotine, salts, flavourings, and, a powder. And it's designed to be popped into your mouth, and sit between your gum and your lip, and it releases nicotine. And unfortunately, the snus that's available at the moment is, quite cheap to buy. So you can buy a pack of like 20 pouches for, €5-6.
Okay.
It can be bought in any corner shop. There's no legislation governing snus at the moment in Ireland, although the government have indicated that they're going to address this space. But it comes in really high concentrations and different
kids
flavours.
Are at school then, and they can't take a puff of the vape,
Yes.
They can just pop this into their gum.
Yes, and that's what we're hearing from schools and from teachers, is that, kids are still vaping in schools, and the bathroom is a common place where they report that this is happening. But snus is becoming more popular and being used by kids in schools because it's a bit more discreet.
Yes.
You can never tell that somebody has a little pouch in between their lip and gum. And it is obviously having impact on children as well.
That's what I was going to say. What are teachers saying? Because I know you've been in touch and you've done webinars with Principal Association and stuff
That's
like
right.
that.
Yeah.
And what are teachers saying to you? What are difficulties is it causing?
Teachers are reporting that there's concentration levels are affected by children, that there's, agitation, irritation from children who are heavily addicted, and mental health difficulties is also, especially if a child is already predisposed to mental health issues, anxiety, all of those kind of challenges are coming up for children, especially if they're already addicted and maybe, they can't get access to the product, during school hours.
During the school day.
Yeah.
And Kirsty, just to bring you in there, do you have parents calling you, or do you have young people calling you on the quit line? And what are the worries? Are they the same type of worries that Martina is talking about?
Yeah, absolutely. We receive a lot of calls from concerned parents, and parents who just don't know how to address this with their children as well. The parents are trying their best to understand vaping and how they can help their children quit. And they're concerned with how available vapes are too, and these nicotine products. A very recent example I can give you would be just from a colleague of mine. They went to a concert with their teenage daughter to see a popular artist, like any teenager. But she noticed that there was vape vendors sort of dotted around
everywhere
the
around
area,
the stadium or whatever.
Around the stadium arena, whatever it was,
And Martina, do you think the new legislation that is coming in and the Minister announced, will that help that they're not going to be freely available?
Yeah, so in February of next year, there will be new legislation whereby retailers who sell vapes and or tobacco products will have to register. That's coming in February, and they will have to pay €1,000 to sell tobacco annually and at €800 to sell vapes. annually. And there's also a ban on movable retailers. So, kind of selling out of a van and that kind of thing.
Okay, yeah.
At the moment, there's very little legislation or none on snus and the availability of snus, and they can be provided and handed out at events. And I've seen something similar to yourself, Kirsty, where, I brought my own daughter to a concert in the O2 and they were handing out snus pouches. Free, here, have a sample, you know what I mean? And there's nothing in the legislation that's prohibiting that at the moment. But there is intention to work on that and to prohibit.
And that is a perfect thing
advertising
for a young person to say, oh, well, look, it's free, I'll just try it.
Exactly.
I'm still not convinced that people know that there's nicotine in vapes and pouches and all of these things. I wonder, do they just think that it's this flavour and they just think it's nearly like a sweet, or it's just like an appetite suppressant or something? Do they actually know that the amount of nicotine that's in it, Martina?
Yeah, I think that's one of the challenges, that young people really think because it's marketed as vapour, that it's harmless, like it's like a vapour that might come from the steam from a kettle or something. But actually it's an aerosol.
Right.
So it is pressurized aerosol that has tiny particles in it, cancer-causing chemicals.
We don't even know really what chemicals are in it. There's nothing to tell us what's in it.
There's lists of different types of chemicals: cadmium, lead, tin, ultrafine particles that go right deep into the lungs when you inhale, heavy metals and diacetyl and lots of different chemicals like that. But what's in each individual vape is anyone's guess, because there's so many thousands of products, and our environmental health colleagues who work around monitoring the legislation don't have the capacity to test every single product on the market. It's just impossible. So really it's buyer beware, and also when they have tested products in the past, what they have found is that what it says on the label is not actually what's in there. And many products that were labelled as 0% nicotine, for example, contained nicotine or contained way higher doses than the legal limit. And that's just a sample of products that they were able to test.
So say, for example, one disposable vape. What would many cigarettes would that be equal to?
Yeah, so one of the popular brands is a product called Lost Mary that has about 600 puffs in it. And 600 puffs, 15 puffs of a regular vape is about equivalent to one cigarette. So that 600 puff vape is the equivalent of 40 cigarettes.
40 cigarettes? And would somebody smoke one vape in a day?
They could potentially, or every second day.
So that's like 40 cigarettes in a day. Kirsty, have you heard that? Have people phoned you in relation to that kind of stuff?
Absolutely, yeah. I have a lot of people calling in, wanting to quit vaping, smoking, as Martina mentioned a while ago, dual users.
And what do you say to them?
Well, it's very concerning, with dual users. We try our best, to accommodate them with the support, offer the standard treatment programs, behavioural supports. But it is a genuine concern, with dual users, because we're seeing higher dependencies than I've ever seen, since I've become an
So you
advisor.
can do an over-the-phone assessment with somebody, can you, when they call?
Yeah, absolutely.
Yeah.
That's
So Kirsty, if somebody calls you and they are a dual user, my understanding is it's somebody who smokes and they may be taking up vaping because they wanted to quit the smokes and now they're smoking and they're vaping. So what would you say to them? Because I thought that the quit service was, do you just direct them to other people or do you offer a service to them?
we can direct them to other services, local services. That's what they'd like. It is their preference. But we do provide a lot of support on the Quitline with our standard treatment program.
And what would that be? What does that entail?
So we firstly assess the client's readiness, if they want to quit, because that's obviously very important that they want to do it for themselves, and we assess their current smoking, current vaping, talk about, past quit attempts maybe that they've made, and assess their dependency. And I'm finding with dual users that it's the highest dependencies. Because of that, they're smoking maybe up to 20 cigarettes a day and vaping.
And with people with dual users, I suppose when they smoke a cigarette, sometimes they would go outside to smoke the cigarette. But now they go outside to smoke the cigarette, but they're vaping as well inside. So you can imagine it's increasing the dependency all the time.
Yeah.
So is that the type of thing that you're finding with them?
Yeah, absolutely. I even find maybe they'd be less inclined to quit vaping, they'd rather maybe quit smoking.
And do you follow up with them? Do you continue on that treatment plan? So you phone them, you sort out a plan, then you call them after 4 weeks as well or something, do you?
Yeah. So initially, as I mentioned, we'd have a consultation, assessing their current smoking. And once they set a quit date, we'd have our weekly appointments after that, following
Oh,
up
very
to,
good.
to see how they're doing and providing as much support as possible.
Yeah.
It doesn't have to always be our scheduled appointments. We're there to support them. Any extra support available as well.
Very good. So if somebody
needed.
phoned up, could they call and ask for Kirsty because they've been talking to you before?
Yeah, absolutely.
Oh, very good.
We do try to stick with the
same person to develop the
advisors.
relationship.
Yeah.
That's really good. And how long do you continue that treatment plan, or how long does it go on for?
So the standard treatment program is in total 52 weeks.
Okay.
But the most important contact that we have with the clients is in the first 4 weeks.
Very good. So Martina, what about the nicotine replacement? Can somebody who phones the Quitline get nicotine replacement?
They can, yeah. So when they set a quit date and kind of agree to the follow-up and the support, the standard treatment program that we call, and their nicotine levels are assessed and they set their quit date, we will provide them combination nicotine replacement therapy. So the Stop Smoking Advisors will send an order online to our pharmacy provider, and then it's couriered or posted out to them.
Oh, very good.
Yeah.
Yeah.
So they get 2 products. They get a background dose of a patch plus a short-acting product like one of the Nicorette gum or the mouth spray or a lozenge.
Yeah.
And those are designed to provide a small dose of nicotine just to relieve withdrawals. So they're not designed to stimulate the kind of feel-good dopamine chemicals that you get from vaping and you get from smoking, but they're just a smaller dose delivered in a different way to just relieve the negative impacts and the negative cravings. And it's a reducing dose over a 12-week period, over a 3-month period.
Okay. And so if we give nicotine to people, that's just really free nicotine is for people who smoke.
Yeah. Well, if they're dual users, they can also access nicotine replacement. What we don't have at the moment is an official, I suppose, stop vaping service.
Okay.
So while we do try and provide on the Quitline, Kirsty and our colleagues try and provide support in terms of behavioural support to somebody who's maybe vaping only, we don't have access to publicly funded money from the department for stop vaping care yet.
And do you think we need something like that?
We possibly do, but it is complex because many of the medicines are not licensed for stop vaping care. And we've commissioned the RCSI to conduct studies in terms of what works in terms of stop vaping care and stop vaping services. So we're looking at, there's a number of trials going on in Canada, there's some work going on in Holland and various other European countries. So we're looking at, the world is grappling with this issue, So we're looking at what they're doing in terms of stop vaping care, what medicines they're trialling, and seeing whether or not we can get funded and we can get, a pilot service kind of established here.
Because part of you would think, but they're very different products. This cigarette and the vape is very different. So part of you would think, if the nicotine works for the smoking, would it work for vaping? But obviously we don't have all the evidence and we don't have the license, like you say. So it's not as easy as just transferring it. And you're looking at international evidence, obviously, of what works.
Yeah, like to get publicly funded medicines, you need good, robust evidence behind that.
Of course.
But what we do advise, and on our website for those who are interested in quitting vaping, they can self-fund the nicotine replacement and go to their pharmacist. And in most cases, pharmacists will advise that they could try nicotine replacement. Nicotine replacement is an over-the-counter medication, actually, so it doesn't require a prescription anymore. So it is likely that nicotine replacement would be helpful in terms of stopping vaping, to manage the physical withdrawals. There's the whole behavioural side, which is, the patterns, the familiarity, the triggers that people have in terms of when they vape, the emotional connection that people have with smoking and vaping, that needs to be worked on with our Stop Smoking Advisors in terms of that chatting and those consultations.
And is that first port of call the Quitline?
Call the Quitline 1-800-201-203.
Okay, and then you could refer on to either a smoking advisor or then you can advise them, Kirsty, isn't it?
Yeah, absolutely.
And if we go back to vaping, do you think Ireland is playing catch up or is it just an international issue? Martina. Have we higher numbers than other people, or is this just something that's happening at the moment?
Well, it's an international phenomenon. We are playing catch up, I'm afraid, in terms of the legislation. Our legislation is coming now, but the last, I suppose, 9, 10 years, we have allowed the industry to market to our children.
Mm.
So the prohibition, so we do have a law that prohibits the sale of vapes to children. That came in December 2023. So it's a little bit late, but it is in now. So at least we are banning the sale to children. And then the new pieces of legislation that are coming in, which will hopefully prohibit advertising, point of sale display, whereby, products can't be in your local centre shop right on the countertop or
Because
right
you pass
behind.
by a vaping shop now, these 24-hour vaping shops, it looks like a sweet shop. I mean, some of them do sell sweets as well, but the colours, the designs, I mean, you can really have a vape to match every outfit you're going to wear
Yeah,
and every colour. And apparently some of them are neon lights, so that they're kind of neon if you're at a party or a disco or something. And it's just mind-boggling.
it
It's a
is.
minefield at the minute.
Yeah.
So I suppose the sooner the
Yeah.
legislation is in, the
Comes in
better,
the
isn't
better,
it?
yeah. But I mean, developing legislation like this is complex, to be
Yeah.
fair. And the industry challenge every piece of legislation that comes through as well. So they are watching the space. They take legal challenge. They have a lot of money.
That's the thing, they've huge money.
Yeah. And so making legislation that's robust takes time. We have to notify to the EU when we make Irish law as well, which
Yeah.
sometimes delays things. But I was really glad to see the Minister got approval there recently to bring forward the Single Use Vapes Act, and then the other act, an amendment to it, whereby, nicotine pouches are going to be included. And there's a move to restrict advertising, restrict flavours, restrict colours, restrict products that look like toys or
Very
resemble
good.
toys.
Yeah.
So there is definitely
So the same way as
desire.
they did with the cigarette packet, they had to rebrand them and put warnings on them and stuff.
Yeah, absolutely. I mean, I suppose all of the marketing tools that the industry use, like colours and flavours or whatever, we're trying to take those away, I suppose, and try
Yeah.
and make them less attractive to young people. The other piece of legislation that came in on the 1st of November, there was a tax put in on e-liquid, so 50 cent per mil on e-liquid, and that, makes vapes, I suppose, less attractive in terms of price, because at the moment they're very attainable for a young person,
Yeah.
to buy themselves or club together. And a lot of them have little jobs and, at the weekend, or so they have access to funds. So, I suppose making them more expensive is another tool to try and,
Yeah.
help avoid use.
So Kirsty, when you have parents calling in, is there any kind of misconceptions they have, or do they think that vaping is better than smoking, or what types of things are they saying to you?
Absolutely, yeah. There are parents who believe vaping is safer than smoking, but realistically, any nicotine use in children and youth is harmful. It has effects on brain development and learning. It increases anxiety, stress, and it's proven to be a gateway to smoking tobacco later on. Some of my clients started vaping young, transitioned into college, then they started smoking tobacco because it seems more of a mature thing to do for their age group.
Yeah. And Martina, talking about harms then, can you explain a little bit about the harms and what the whole vape and e-cigarettes, what they actually do?
Yeah, so I mean, there's the physical effects and then there's the mental health effects. So, in terms of physical effects, obviously, nicotine in high doses causes damage to heart, increases blood pressure and makes your blood cells a little stickier and easier to clot. So, increases risk of stroke and all of that. Vaping, obviously, you're inhaling an aerosol with fine particles deep down into the lungs. So, your risk of asthma, bronchitis, developing, infections, and long-term lung damage increase obviously as well. While we can't say at the moment, that vaping causes cancer, because that will take decades for us to kind of understand and tell in terms of cause and effect. There are cancer causing chemicals within e-cigarettes. So, I mean, it's not a harmless substance that someone is inhaling. And obviously nicotine in and of itself causes addiction, which changes the brain chemistry. And young people's brains are developing even up to the age of 25. And what happens is they develop nicotine receptors. which become stimulated. And those nicotine receptors are there for life. And anybody who has smoked and maybe smoked years ago, and they could even relapse, 20 years later, 30 years later. And we sometimes have people calling the Quitline who smoked years and years and something happened and then they relapse. And that's because the brain chemistry changes physically forever once you become addicted to nicotine and you develop those nicotinic receptors.
They're there forever.
They're there forever. So that's the risk, whereby young people think that this is just a harmless thing that they might try in adolescence, but actually they're changing their brain chemistry forever, unfortunately. Nicotine has an effect on mental health as well, in terms of sleep, in terms of increasing anxiety, because once you become addicted to nicotine, your body cycles through highs and lows of nicotine all of the time. So you're constantly craving that drug in order to feel normal.
Yeah.
So you begin to need nicotine in order to feel just regular and just normal. Like in between smoking and vaping, your nicotine levels drop and you start to feel anxious. Then you might vape or smoke again. Then you start to feel normal again. Then you drop again. You know what I mean? So it's cycling through this drug use, basically.
It just makes sense the way that you describe it there. And when we're talking about drug use, then the other thing that I find really concerning is this HHC and THC and CBD. I mean, I'm confused with all of it, but there is big worries about people vaping those type of things as well. And they're not nicotine. They're a lot more, they're a lot more serious, or as serious as nicotine.
Yeah, so that's another channel that young people are using to experiment with synthetic cannabinoids. So HHC and THC are synthetic cannabinoids that are put into e-liquid and are vaped. And those are really harmful as well in terms of mental health impacts, anxiety. And if you have any predisposition to a mental health condition, exposure to these drugs in our adolescence is really risky in terms of, having a relapse or having a psychotic episode. And we've had some incidents of schools contacting us where kids were vaping and they thought it was actually a nicotine vape, but it contained HHC. And, they were very distressed and they had to call ambulances and, a huge incident in the school. So it has allowed young people to access synthetic cannabinoids. And some of these synthetic cannabinoids are even really concentrated and higher doses of cannabis than in a regular cannabis, you know what I mean? Cannabis resin.
And that's another, so it's another gateway. Vaping is another gateway for these type of drugs as well.
Absolutely.
Isn't it? And then is there but there has been legislation brought in on that as well.
There has, yeah. So HHC was prohibited and there was a new law came in the summer this year prohibiting the sale of HHC. But that said, I mean, I suppose it's a huge challenge for, the Gardaí to police that and for it to filter out and for not to become available. And of course, you have the online market, which is huge and very difficult to monitor and police, where kids are accessing lots of different products.
It is such a battle. It's a battle for parents and guardians out there. And Martina, what would you, for parents who are listening, what are the type of things that you would say to them, or where do they go for help in the first instance? Like, you're just concerned, you're not 100% sure, your child is denying, they're saying, no, it's not me, it's Jimmy down the road. Like, what would you be saying to them?
Yeah. So I would say, find the right moment. Don't dive in there and start giving out straight away. I know that's really difficult as a parent
I'm a mother of 4 and I would be inclined to do that.
Yes, it's very difficult.
So I'm going to listen to you intently now, Martina, to tell me what I'm supposed to be telling my children.
And, no one gives you the handbook on becoming a parent or, navigating parenthood through all the different ages. It's the one job that a lot of us do, but we're not trained to do. So, it is challenging. But I would suggest that, you find the right moment to kind of start the conversation. Don't go in there with the, giving out. Ask questions. What they're doing as an adolescent is practicing becoming an adult and making their own decisions. So you're exploring with them why they tried vaping, if they did try it. Did they feel under pressure? How did they feel afterwards? Is it something they want to do regularly? I suppose highlighting the risks of doing that. Helping them to prepare to respond if they feel pressured to try vaping or pouches, if they haven't already tried it.
That's a good one, actually, so that they know what they can say, that they don't feel like they're just the odd one out because they're the only one not smoking. So you're ready with an answer. If somebody's saying, we'll try this or whatever, they can say, well, actually, it's not something that I really want to do, and be okay
be able
saying
to do
that.
that. Yeah. I
Yeah.
mean, my own daughter navigated this at, 13, 14. And, she told me that she tried it and she didn't really like it and she didn't know how to kind of respond the next time it would happen.
Yeah.
And she has asthma. So I suggested to her that she would tell them that, she has asthma and the teachers might have to be called if she had an attack or
Yeah.
whatever. So, there'd be a big hullabaloo and everyone would know about it. So therefore, she was able to still kind of be in the group, but
Yes.
not partake herself.
Yeah.
So they can tell a little white lie
Yeah.
about, a health issue that they might have or whatever. But it's
Yeah.
just around helping them to prepare to respond. And if they are addicted already, it's around encourage them to think about quitting, talk about the long-term impacts. Like it has impacts in terms of memory, learning. It has impacts in terms of your physical activity and your ability to breathe in clean air and oxygen and get oxygen to your lungs if they're interested in sport. That can be a good angle to try and steer them away from smoking and vaping. What do they really want to achieve in life? And is this helping or hindering them in achieving that?
I suppose it's like every conversation we have with our kids or with our young people, isn't it? Really, it's educating them and giving them all of the information, and then you hope they're going
You
to make the
hope.
right decisions.
Yeah.
But not to be naive to think, well, it's not just my kid wouldn't do this or my child wouldn't do this.
It's so common,
it's
so
so
it's
common,
it's
yeah.
1 in 5.
1 in 5.
1 in 5,
That's
so that's, think
That's
about
the
a class.
reality.
That's the reality of
Yeah.
it. And it's totally normalized. So as part of the campaign, we talked to parents and we talked to young people themselves to help us develop the campaign and the tone and the audience. And parents told us that they don't know enough about this. So hopefully listening to this podcast will
Yeah.
help them, and going on our website will help them to kind of understand a little bit more. So educating themselves about this space. And young people said that it's very normalized among their peer group, from first year on when they go into secondary school, first, second, third year, they don't see any harm in it. It's all part of their normal culture. Some of the reasons that they think vaping might help them with anxiety or stress in school, but actually nicotine addiction increases anxiety and has a negative impact on mental health, but people think that it will have a positive impact, but actually it's the opposite.
Yeah.
So we've developed lesson plans as well for schools through SPHE, which is the Social Personal Health Education Curriculum, lesson plans for first, second and third years around nicotine, smoking, vaping, pouches. And we've also developed a toolkit for use in out-of-school settings for youth groups to kind of explore and discuss all of these topics with young people. And then we have the prevention campaign, and the youth side of that will be coming out next year. So we look forward to that. And we've been looking at what they're doing internationally, and what seems to work is where young people are talking to young people themselves, through social influencers and whatever. And the channels that we will use in the campaign as adults and as parents, we mightn't see it because we're not in the spaces that they're in.
Of course, yeah. And that's what we can do. So there is an awful lot of work being done in the background, and there's a lot of support there for people as well, I suppose. That's what we're saying to parents, is to please go on to the HSE, put in whatever you're looking for, whatever you're concerned about, and there should be information there. And you've been in touch with the parents and the teachers, the schools as well, SPHE.
Yes, we have, yeah. And we produced a resource for schools, and we're just updating that in terms of how they can amend their policies around substance misuse and how they can get informed in this space themselves. The other thing to note is if parents know that there's a vape shop or a retail store, any shop that's selling vapes to a child, either their own child or somebody in their community, you can report that to our compliance line, and that's 1-800-333-100, or email info.ntco@hse.ie, that's the National Tobacco Control Office. So info.ntco@hse.ie, or phone that number and you can report that, and our environmental health colleagues will go out and investigate that shop. They do test purchasing as well, so they will send a minor in under strict protocol and conditions to see, like a secret shopper for want of a better word, to see if they're getting sold, and then they can prosecute that retailer if they're breaking the law.
Yeah, well, thank you very much for that. And thank you so much, Kirsty, for today. So I suppose what we want to say is if you're a parent, teacher or a young person concerned about vaping, remember that there is support available. You can just visit hse.ie for reliable, up-to-date information about vaping and nicotine products. A conversation guide really, Martina, for parents as well, isn't it? And you can tailor that to whatever age your child is then if you have noticed that they're vaping. The HSE Quit helpline is there for confidential support and advice. And Kirsty, that number again is
1-800-201-203.
Very good. And if you're worried about your child or you're looking to quit yourself, you can also speak to your GP or your local pharmacist, you said, Martina?
Yeah.
And if you want to get in touch with us at HSE Talking Health and Wellbeing, please email us at healthandwellbeing.communications.ie. And thank you for listening.